first thing is planning. We discussed about something called planning, right? How to plan the case. Before starting, spend some time in planning. Don't rush in. Okay. Even before going for one day trip, we are planning so many things. But before starting a patient, we should plan from different angles. We should not miss anything. Okay. So this patient, so planning involves, we have to use the clinical photos and videos during planning. Then you have to go for the X-ray plan. Okay, so use this, then you will get the real picture. So you cannot do the planning only by seeing the X-ray. You need to see the clinical picture also. Okay. So this patient, upper only few teeth remaining with a lot of fillings, chewing only in the anterior tooth. The bite got collapsed, the vertical dimension is reduced. The prosthetic space is also not very good. Even the molars are not so good. So we are planning for upper full mouth. So this is called bite down smile. You have to ask the patient to clench the teeth and smile. Then you will understand how much the VD is reduced. You can see the upper teeth are touching the lower lip. That means she is over closing. Okay. And they are slightly coming out also. Okay. So the patients lost most of the teeth. Many patients, around 35 to 45. The reason is multiple DC or perio issues. Right? But more than this, there are some other reasons which lead to total edentulescence. That is the wrong chewing pattern. Chewing on only one side. Or if this side also goes down, the patient starts chewing on anterior. The healthy chewing is bilaterally the patient should use it. But slowly, because of some issues, the patient starts using only one side. So that starts problem. The patient loses some teeth. If the patient loses both the molars, then she will be definitely using the anterior teeth. Then anterior also good. So the wrong chewing pattern. This is one reason. And another reason is not replacing missing tooth. Then and then. If they delay replacing missing tooth, the other teeth suprarectal, migration, and also the wrong chewing pattern, slowly down the lane 10 years, they are going to lose 10 to 12 teeth. That is almost equal to totally edentulescence. That means, one movie something I will tell you. You are at this age, okay, by coming soon. Right? Edentulescence coming soon. It is not edentulous, but edentulescence is going to come soon. Because if she wants new good teeth with good treatment with long-term success, we have to extract all the poor prognosis teeth. So now, what is the surgical planning? Surgical planning. First question is, what teeth you are going to remove? First decide that. Okay. When the patient comes, you don't have to tell the plan that day itself. Take the photos, send for X-rays. When the patient comes with X-rays, send back again. Take 1 or 2 days, then you tell the plan. No need to rush and tell them. So the first thing is, what teeth needs extraction? Then only you will get an idea how many teeth you are going to replace. Of course, this patient we are going to remove all the tooth, but some partial cases we need to decide whether this tooth I have to keep or whether we have to remove it. So how many teeth to replace? How many teeth needs to be replaced? This question leads to this. Okay, now this question leads to how many implants? This is an important question not only for us but for patient also, because the number of implants determines the cost and all. Okay, how many implants? And another question, where you are going to place. For example, if upper jaw is, where I am going to place, canine or premolar or molar. So location, decide the location. Okay, number of implants, then location of implants. Then after you decide the location, what design you are going to use. whether you are going to use compression design or basal design. Very simple, my decision will be very simple. If there is no label plate, I will go for basal. Otherwise, I will go for, even if the ridge is very thin, we can select a small diameter compression plates, 3.3 or 3.5 available in some. Okay. And another question is, what is the D and what is the L? What is D and what is it? Diameter. What is the diameter and what is the diameter? I forgot to tell you, the basal diameter is 3.6, 4.6, 5.5. Out of this, we don't use this, there is no need to buy this. 4.6 is not necessary. Only for 3.6 and 5.5.
Is standard for all the companies?
All the companies. All the companies. Okay. 3.6 is the most commonly used. So where we use 5.5 in only selected places. Upper molar palatal socket. Okay, it will engage nicely. You don't have to drill. Just take a 5.5 and you can place it. Or lower premolar socket.
Can you come again, sir? Again that one?
5.5 is useful for upper palatal roots, upper palatal socket.
That is
5.5 basal.
for all the palatal sockets. Either it is first to second molar.
Yes. First molar, second molar. And sometimes in the lower second molar, or first molar, second premolar. When the socket is very wide, you can place. Usually 5.5, 10, 12 or 14 something. Otherwise mostly it is 3.6. The 3.6 and this is the 5.5. You can see the difference.
Length of placement.
Which one? 5.5.
Everything. 3.6.
Oh, what is the available length you are asking? One is 10, 12, 14, 17, 20, 23, 26, 29.
Like 10, 12,
This
15. Is it
See, the
clear?
basal length is different. The compression length is different. The length which I have written is for basal. Compression I will write here itself. Okay. 8, 10, 1.5, 13, 16, 18, 20, that's it. Of course, this varies a little bit between companies. You can see how wide it is, the 5.5. Even 6.5, 7.5, 7.5 also it is given in catalog, but they are not used.
This is 5.5, sir?
Yes. That is 3.6. You can see the difference in diameter.
This is 3.6.
Yes.
Golden one is 3.6.
Yes.
So 3.56 comes in golden only. That is again.
No, it's not like
It's
this.
not like
The Byron company it gives all in golden color.
So mostly implant length which the 10 size implant அப்படின்னு select பண்ணுவாங்க. Implant ஓட நீங்க 10 mm implant அப்படின்னு சொல்லுவாங்க. Length which தான் நம்ம
Yes. Of course, if the 10 means it is compression means it is from the threaded part. If it is basal means including the neck part. This is called dynamic video. So we understand how the lip moves because one side of the lip may move different. After treatment the patient may tell after treatment only my lip is going one side. So we should have this document before surgery. Even more important than smile photo, this video is called dynamic video. This is very essential. It is touching the upper because of the closed bite, and here there is lack of lip support. Here the lip is thin, and she is not smiling fully. And thing is there is not much gummy smile. So that is another reason why you are taking the videos. How much gummy smile is there? So what is the smile like? So there are three kind of smile: low smile, medium smile, and high smile. Okay, this kind of medium. High smile means all the gums are same.